Hey guys, so today I'm decided to make a video on the region of the leg as well as the forearm. So I'll try to make the two a bit parallel so that study becomes a bit easy. So we'll start with the leg region, then we will move further up the body, then we talk about the region of the forearm. So of course the leg is those two bones, that is the tibia, the more medial one, and the fibula, that is the more lateral one. Then in relation to the forearm, sorry, we have the medial ulnar bone and the lateral radial bone. Then the sagittus bone together with the medial tibia bone of the leg, they are the preaxial bones. Then the postaxial ones, you have that lateral fibular bone as well as the medial ulnar bone of the forearm. So I've done a video on the bones, but then I'll just talk a bit about the malleoli of these two bones. So that is the medial malleoli of the malleoli of the tibia bone is wider than that of the lateral bone, that is the tibia. However, the lateral malleolus is actually longer than the the medial malleolus. Same applies when you get to the region of the wrist. You find that the standard process of the radius is 1.9 centimeters distal to that of the ulnar bone. For you not to forget, just remember the malleoli of the lateral malleoli is longer than the standard process of the more lateral bone, that is the radius bone, is actually long as well, that is 1.9 centimeters here. Then in the foot, of course, it's 1.3 centimeters or 0.5 inches longer. Then so talk about the fascial compartments of the legs, and as well as those of the forearm. The more easier ones being the lateral compartments, of course, both having two muscles, but we'll just start with the anterior compartment of the leg. The anterior compartment of the leg will also have muscles that are extensor muscles that pass deep to that extensor retinaculum. Then we also talk about how you have the nervous supply coming from that sciatic nerve. The sciatic nerve, of course, being sacral plexus in origin, that is L4, L5, S1, S2, S3. Then this sciatic nerve, of course, crossing down with the more superficial common peroneal portion and the tibial portion, of course, and then the common peroneal portion giving rise to that nervous supply to the shoulder head of the biceps femoris, one of the hamstring muscles. Then the tibial portion giving rise to all other parts of that hamstring compartment. Then in the popliteal fossa, you have, of course, the common peroneal passing superficial, then the tibial portion passing deep to those heads of the gastrocnemius, together with the posterior tibial artery, the artery of the posterior compartment. Then you have the common peroneal portion dividing into a superficial portion, that is the nerve to that lateral compartment of the leg. Then you have the deep peroneal nerve that actually passes in that opening on the interosseous membrane, together with the anterior tibial artery to be the nervous supply to the muscles of that anterior compartment of the leg. So we'll talk about the muscles, but this anterior compartment we have more medially, the border will be the tibial bone. Then more laterally, you have that anterior fascial septum. Then the muscles, of course, you have that tibialis anterior. The tibialis anterior muscle have the same insertion as the peroneus longus. Remember, the peroneus longus is the muscle of the lateral compartment, then gets to that base of the fifth metatarsal bone, then curves more medially to go and insert in that medial cuneiform and in the base of the first metatarsal bone, which happens to also be the insertion of that tibialis anterior, arising, of course, from the anterior surface of the tibial bone and the interosseous membrane. Remember, the tibialis posterior being a muscle of that flexor compartment behind, will have an origin that is a bit different. That is, it arises from the posterior surface of the tibia, the interosseous membrane, as well as the posterior surface of the fibula. It actually comes from both the bones, then goes to insert on that navicular bone and the surrounding other small bones of the foot, with the exception being the talus. Of course, the talus doesn't have any muscular attachments whatsoever. Then I've talked about the tibialis anterior. Then you also have the extensor digitorum longus going to insert in the extensor digitorum longus will arise from the anterior surface of the anterior surface of the shaft of the fibula. So most of the muscles of this anterior compartment arise from this anterior shaft of the fibula, with the exception of this tibialis anterior. Then you have that extensor digitorum brevis, that will actually be a muscle of the dorsum of the foot, arising from that anterior surface of the calcaneal bone. That is the bone that forms the prominence of the heel. Then we also find that extensor hallucis longus, and then you have that peroneal stachys. The peroneal stachys being for you not to forget the insertion of this peroneal stachys, it actually has the same insertion as the peroneus brevis, the other muscle of the lateral compartment of the leg, that is on the base of the fifth metatarsal bone. Then the nerve supply, I've talked about that deep peroneal nerve that starts more lateral to the anterior tibial artery, then goes anterior to it, then goes finally lateral. And then you have that anterior tibial artery, of course, being the smaller terminal branch of that popliteal artery at the lower part of that popliteus muscle. Remember, the popliteus muscle arising from the lateral condyle of the femur, separating that lateral collateral ligament of the knee joint from the lateral menisci, then attaching above on that surface of the tibia bone above the soleal line. Remember, the soleus muscle, that is a muscle of the posterior compartment that we'll also talk about, arises below this line or at that level. Then at the ankle, let me just talk about the structures that pass posterior to this extensor retinaculum that I've been talking about. So the mnemonic is: the Himalayas are not dry plateaus. The Himalayas are not dry plateaus. So the T is the tibialis anterior. Himalayas, H, the extensor hallucis, are not artery and the nerve. Dry, if that extensor digitorum. Then plateaus is the tendon of that peroneal stachys, as it goes to insert in that base of the fifth metatarsal, of course. Then I've already talked about the muscles of the lateral compartment, those two, the peroneus longus and the peroneal stachys, when I was talking about the anterior compartment. Then the nerve supply is from the superficial peroneal nerve, which then ends as lateral and medial cutaneous branches of the skin of the dorsum of the foot, with the exception of that cleft between the first and second toes, that is supplied by the termination of the deep peroneal nerve, as well as the more lateral compartment that gets its innervation from the pseudonape. Then let's say forget the artery of the anterior compartment of the leg, that is the anterior tibial artery, ends as that dorsalis pedis artery, of course. But then in 14% of the people, this artery may not arise from this and may come from a perforating branch of a larger peroneal artery, which originally comes from the posterior tibial artery, that is the artery of the posterior compartment of the leg. So now we will get straight into the posterior compartment of the leg. So for this posterior compartment of the leg, you find that you have the deep transverse fascia that separates the muscles into a superficial and a deep group. So we have three muscles in that superficial group. You have that gastrocnemius, the soleus, and the plantaris. I've already talked about okay, let me just repeat it. So you have that gastrocnemius, that is the lateral head, and the medial head. The lateral head coming from the lateral condyle, and the medial head coming from that medial condyle. Then you have the plantaris also coming from that lateral condyle. Then you have the soleus muscle, that is actually arising from the shafts of the tibia and the fibula. Then they all are inserted in that calcaneal bone. However, the gastrocnemius and the soleus, of course, have that common tendocalcaneus that goes to that calcaneal bone, as well as the plantaris, who actually insert also in this calcanea. Remember, the plantaris is analogous to that palmaris longus in the forearm. Sorry, that is not really of any importance, and this tendon can be used to make autographs and tendons for some of the long flexor tendons and extended tendons. Then the deep group, now we have you have the popliteus muscle, of course, that I've already talked about, arising on that lateral condyle, going to insert above that soleal line of the tibia, and then it separates the lateral collateral ligament of the knee joint, that is the rounded one, from the lateral menisci. Then you also have the flexor digitorum longus arising from the tibia. Then you have the flexor hallucis longus coming from that shaft of the fibula. Then you also find the tibialis posterior that I've already talked about, arising from the posterior surfaces of both the tibia and the fibula, as well as the interosseous, so that's that interosseous membrane that is intervening between the medial the medial tibia and the lateral fibular bone, and then inserting that navicular tuberosity, as well as the other as well as sending other slips to the surrounding small bones of the foot, with the exception being that talus that doesn't have any muscular attachments. So the nerve supply to this region is the tibial nerve. Then you have that posterior tibial arch. So you find that the tibial nerve, being that largest branch of the sciatic nerve, will actually start more medial, then goes posterior, then ends up being lateral to this posterior tibial artery. The posterior tibial artery will then divide at the ankle joint to give you, of course, the lateral and medial plantar arteries. Then you also have the medial nerve, the tibial nerve, the tibial nerve also dividing to give you lateral and medial plantar nerves. However, you also have that calcaneal branch. Then so if I have the foot like this on the ground, the muscles that actually dorsiflex, these muscles are the muscles of the anterior compartment of the leg, they dorsiflex. Then if I have a lesion now to then the nerve to the anterior compartment, so instead of the balance between plantar flex and dorsiflex, and that would have the foot resting on the ground, I'll actually have a foot drop, that is equinovarus. Same applies if I have a lesion or to the nerve of the posterior compartment. Then I'll find the clinical sign of what they call it, calcanophalcus, I think. I'm not quite sure of the pronunciation to that. Then then you also find the flexor retinacula at that ankle joint. And then the mnemonic this time around will be the doctors and not hunters. Tibialis posterior. Doctors now find the digitorum being more medial as compared to the hallucis, that is the hunter's part. Then of course then the artery and the nerve being in between the hallucis and the digitorum. Same applies on that anterior compartment, but then what's changing is the arrangement of the digitorum and the hallucis. Then that's just about it for the region of the leg. Then I'll also now talk about the region of the forearm, but then for the forearm now, I'll start with the cutaneous innervation, then try to also get back to the cutaneous innervation of that leg region that I had neglected. So I'd find that that lateral cutaneous nerve of the forearm, that is a continuation of the muscular cutaneous nerve. Remember, the muscular cutaneous nerve piercing that coracobrachialis to come to lie between the brachialis and the biceps brachii, and giving innervation to these muscles. Then continuing down into the forearm is that lateral cutaneous nerve of the forearm. Then you find the medial cutaneous nerve of the forearm as well, being a branch of the medial cord of the brachial plexus. Then it also supplies that region of the medial side of the forearm. Then you also have the posterior cutaneous nerve of the forearm, being a branch of the radial nerve, also giving cutaneous innervation to this the skin of the posterior surface of this forearm. Then as for the leg, you have that saphenous nerve. Remember, the saphenous nerve being one of the cutaneous innervation to branches that actually arise from that femoral nerve, a branch of the lumbar plexus. Remember, the femoral nerve divided into an anterior and posterior division. Then the anterior division gave rise to two, that is the anterior and intermediate cutaneous nerves of the thigh. Then you also have the posterior division giving rise to that muscular branch to the quadriceps femoris, as well as that saphenous nerve that accompanies the great saphenous vein to the posterior, on the medial aspect of the lower limb, to actually lie anterior to that medial malleoli. However, that saphenous nerve will actually be more superficial, more anterior to this great saphenous vein. Then you have that lateral cutaneous nerve, that is a branch of that common peroneal nerve. Then you'd also find that yeah, that's just about it. Then we'll now talk about the anterior, posterior, and the lateral compartments of the forearm. So you'd find that the anterior compartment now is the flexor compartment, the posterior compartment is now the extensor compartment. Then the the lateral one is not, it's more variable. So we'll start with the lateral compartment. Such a compartment, the muscles all arise from that lateral supracondylar ridge of the humerus bone, that is the bone of the arm. So that you find you have the extensor carpi radialis longus and the brachioradialis being also supplied with that radial nerve. Then you'd find that so usually I actually started using my hand for it to become a bit easy. So when I look at my hand, then I think of the brachioradialis, brachio, right, coming from the brachium, radialis, going to insert on that radius, so that is, it inserts on that stellar process. Then the extensor carpi radialis longus, right, it's extensor carpi radialis longus, muscle of the lateral compartment. So it actually comes from from the lateral supracondylar ridge, then goes to insert on the base of the second metacarpal. Remember, the first one is this one. It wouldn't make any sense for it to insert here, right? Then of course they're given supply with by the radial nerve as well as the brachial. Then the muscles of the anterior compartment have also a common origin from that medial epicondyl of the humerus. Then those of the posterior compartment that have also a common origin from that lateral epicondyle of the humerus. So we'll get straight now into the anterior compartment. My aim is not to clock 20 minutes. So you'd find that we have the Pronator teres. If a special group, an intermediate group, and a deep group, right? The intermediate only has one muscle, that is the flexor digitorum superficialis. So we will start with that superficial group, where you find the Pronator teres, the muscle that formed the medial border of that cubital fossa. So you'd find that the flow of this cubital fossa medially has that brachialis muscle going to insert on the coronate process of the ulna. So same for you not to forget, this Pronator teres has two heads of origin. One of them will come from this very same coronate process of the ulna, then the other one, of course, from that common tendon of origin on the medial condyle, going to insert what on that radius bone. So you also find the flexor carpi ulnaris. So this one also has two heads, and you find that the ulnar nerve actually passes between these two heads of origin. For that Pronator teres, you find the median nerve. Then it inserts on. Remember, we talk about the pisiform bone and the hook of the hamate in the base of this fifth metacarpal bone. Forgive me if I say metatarsal at some point. Then the flexor carpi radialis longus will also go in and insert on the base of the second and the third metacarpal bone. Remember, we talked about that extensor one actually going to sit on the base of the second one. Then for the intermediate group, you find that flexor digitorum superficialis muscle that will then insert on the medial phalanxes. Of course, the profundus, that is the muscle of the deep group, will go in and insert on, or actually go in and insert on the distal phalanxes. Then also on these muscles, you'd find that they are innervated by the median nerve, with the exception of the medial half of the flexor digitorum profundus that actually gets its innervation from the ulnar nerve. Then the flexor carpi ulnaris also get its innervation from the ulnar nerve. Then the blood vessels, of course, remember that brachial artery and the cubital fossa terminating to give an ulnar artery and what you call it, the radial artery. Then this ulnar. Then we talked about the ulnar nerve imaging between the two heads of the flexor carpi ulnaris. Then the median nerve going to lie between that flexor digitorum superficialis and that profundus. The ulnar nerve will be between that flexor carpi ulnaris and that profundus. Then the median nerve will actually be covered, will be sort of posterior to the tendon of the palmaris longus as it goes to insert on the palmar aponeurosis and the flexor ethnicum. That is, of course, another muscle of that special group that I had neglected. Then we'll now talk a bit about the posterior compartment. So for this extensor compartment, you find there's also a superficial group and a deep group. So you find that anconeus muscle that is actually behind that elbow joint being supplied by the main branch of the region nerve before it actually gave that superficial and that deep branch. Remember, the superficial branch would then cause with being latched out to that radial artery. Then you find the extensor digitorum also arising. So the common term of origin for this posterior compartment will be that lateral epicondyle. So this extensor digitorum will go to the extensor expansion of that medial and distal phalanx. Then you find the extensor carpi ulnaris. This one now, instead of having the same insertion as that flexor carpi ulnaris that we talked about, going to the pisiform, the arc of the armpit and the base of the fifth metatarsal, it will now go to the base of the fifth metatarsal only. Then you find the extensor digitorum, of course, going to those extensor expansions, of course, of those medial four fingers. Then for the deep group, you find that extensor indicis, the extensor hallucis longus, you find the abductor hallucis longus. Then you also find the supinator muscle. Then I did neglect the Pronator Quadratus, that is another muscle of the anterior compartment that is actually more distal at the almost at the region of the ankle, as opposed to that Pronator trace that we talked about at more proximally at the region of the elbow joint, actually forming that medial border of that cubital fossa. So you also find the snuff box, that is where you find the pulsations of the radial artery, as well as the this palpating the distal. More proximally you palpate that stylopus of the radius, then more proximally you palpate that scaphoid and that trapezium, though you can distinguish them. So the medial border will be that extensor carpi radialis longus, then the brevis will actually be forming that lateral border together with the abductor pollicis longus, not hallucis, pollicis. So yeah, I've clocked 20 minutes as per policy. I have to cut the video now.